Hi, good afternoon, Tamiza and Dev.
Afternoon.
Good afternoon, Tamiza ma'am.
Good afternoon, Santosh. Good afternoon, everyone.
Good afternoon, ma'am.
Dev, can you hear us?
Good afternoon, Madhukar ji, Tamiza ji,
Good afternoon.
Room sir. Good afternoon. Hello and welcome. Even I think there are a few participants also. Good afternoon, everyone. This is Dr. Sushma Kulelia from the National Institute of Disaster Management. We welcome you all. Hello, ma'am. कैसे हैं आप?
Hello. मैं ठीक हूँ, आप कैसे हो?
All good, all good.
Good.
Hello, this is Honoru. I'm just letting you know that I'm checked in.
Yes, sir. Good morning, sir. So you're audible.
That's great. Thank you. I'll just mute and wait.
Hello, am I audible? Dr.
Yes,
Sushma?
Aradhana. Yes, yes.
So I would like to welcome one and all present here for the webinar. Welcome to the webinar on building the resilience of communities for multi-hazard during COVID pandemic with special emphasis on family emergency management plan. Firstly, I would like to welcome our Executive Director, Major General Manoj Kumar Bindal from NIDM Delhi. I would also like to welcome Mr. Honorul, General Manager, Aga Khan Agency for Habitat, and Mr. Madhurkar Sanap, Head of Emergency Management, Aga Khan Agency for Habitat India. Now, as speakers, we have Dr. Sushma Guleria, Assistant Professor from NIDM. We also have Ms. Tamiza Alibai, Chief Executive Officer, Aga Khan Agency for Habitat India. I would also like to welcome Dr. Zara Kadak Merchant, Chairperson, Aga Khan Health Board for India, and Mr. Deo Raj, Program Coordinator, Preparedness, Aga Khan Agency for Habitat, and our coordinator, Mr. Santosh Kumar, National Program Head, DRR and IS, Aga Khan Agency for Habitat India. I welcome you all to the webinar. Now we have with us Mr. Madhukar Sanap for the inaugural remark. Mr. Madhukar Sanap, currently leading the Emergency Management Department at Aga Khan Agency for Habitat India. He is having an 18 years of work experience in the field of disaster management, and during his period, he has worked with government and international humanitarian organizations in the same domain. He was also among the key experts for developing drought risk mitigation program for Government of Maharashtra, and currently supporting in designing the National Seismic Risk Mitigation Program of National Disaster Management Authority, Government of India. We welcome you to our webinar, sir. Over to you.
Thank you so much, Aradhna. I welcome all of you to today's webinar on building the resilience of communities for multi-hazard during COVID-19 pandemic, with a special emphasis on family emergency management. This webinar is jointly organized by National Institute of Disaster Management, Ministry of Home, in collaboration with Aga Khan Agency for Habitat India. In this virtual classroom, I recognize some familiar names of participants from government agencies, private sector, and humanitarian agencies who have worked tirelessly on the 2030 Agenda initiative. I'm sure we are also reaching out to many other human researchers, practitioners, technologists, innovators, business professionals, and civil society representatives. A warm welcome to you all. Dear friends, we all understand the importance of building the resilience of communities for multi-hazard during the current COVID-19 pandemic. At the beginning of the year, none of us would have imagined our current situation. COVID-19 has directly affected each and every one of our daily lives. Nevertheless, the government, various institutions, agencies, and the communities have worked together and done their best to cope with the crisis at every point of the way. Having said that, it is important to realize that very often we make the mistake by waiting until the crisis occurs to plan for it, because we think that it will not happen to us. But I want you to remember that this is a myth. We must plan for the worst, but hope for the best at all the times. It is predicted that the number of the crises, both in terms of the health and natural calamities, will increase in time. Therefore, increasing our overall and individual preparedness and coping capacity becomes immensely important. While the government and the institutions will always be there to help and support the people, however, we must also work on increasing the preparedness at the family level. Thus, the help of the family emergency management plan, we can prepare our family for COVID and also for the various other crisis situation to come. As you all know, that community-based disaster risk initiatives like family emergency management plan is a process involving sequential stages that can be operationalized to reduce the disaster risk at micro level significantly. It will help in understanding household level multi-hazard vulnerability, risk by undertaking assessment, risk reduction planning, and participatory monitoring. This also demands a decentralized bottom-up approach with intensive micro-intervention at the household level, with the intention of generating confidence, awareness, knowledge, partnership, and ownership for planning and rolling out emergency management plans. Needless to say that it must be done with utmost care and attention, as it will take us a long way. So to guide on this subject, we have our honorable guest and resource persons to talk on the various dimensions of this project. And in these inaugural sessions, I would like to take the privilege to introduce you to our guest and leader, who is also our mentor in the path towards the sustainable development. Today's inaugural address will be given by Mr. Onurul, who is the General Manager at Aga Khan Agency for Habitat based in Geneva, Switzerland, followed with the keynote address by Major General Manoj Kumar Bindal, who is the Executive Director of National Institute of Disaster Management, Ministry of Home Affairs, Government of India, based in Delhi. To introduce both of our guests, As mentioned, the ONU is currently the general manager at Aga Khan Agency for Habitat since 2016 and providing the overall leadership to organization which is currently operational in Afghanistan, India, Pakistan, Tajikistan, and Syria. ONU was previously the country director of World Bank India, and prior to it was the director of Operation Services and Quality in the South regions of the World Bank. He was associated with the World Bank since 1993 and served on the various capacities and in different countries. Prior to working with the World Bank, ONU was with the Ministry of Foreign Affairs of the Netherlands and was the alternative director on the board of agencies, and he started his career teaching economics in Alkmaar, the Netherlands. Welcome, sir, and it's our privilege to have you in this program. Our other honorable guest for keynote address is Major General M.K. Bindal, who is presently the Executive Director at National Institute of Disaster Management. He was commissioned into the Corps of Arms Air Defense in December 1985. An alumnus of the National Defense Academy, Major M.K. Bindal is a graduate of the Defense Service College, Staff College, and has attended the prestigious GS Higher Command course at the Army War College, beside excelling in all the other careers in the Army. He holds the Master degree in Defense and Strategic Studies, as well as Master of Philosophy in Defense and Management Studies. During his more than 3 decades of service, he has held important command and staff assignments. Earlier, he was also posted as a Deputy Director General in Directorate of Army Air Defense, where he was dealing with the operations, training, air defense control and reporting, and intelligence issues. United Nations missions in Mozambique, where he was deeply involved in the liquidation of the missions. And peacemaking at New Delhi, and also some as training centers. So with this, I, on behalf of the organizer, would like to welcome our honorable guest for this session. And with this introduction, would like to welcome Mr. Ono for inaugural address. Thank you so much, sir, and over to you.
Thank you very much, Madhukar. It's really a great pleasure, and I would also like to acknowledge Major General Manoj Kumar Bindal, everybody else from NIDM, and of course our partners from the Aga Khan Agency for Habitat, our team, and other parts of the network. It's really a pleasure, although having lived in India for quite some time, as you know from the introduction, I just feel sad we have to do this virtually. I'd be so happy to have an event in a real room with real people and enjoy some samosas at the coffee break or the tea break. It would be so nice. But anyway, this is how we have to do things. The advantage is it's easy to reach out and communicate. I would like to just very briefly explain what the Aga Khan Agency for Habitat is, how it came about, because it's actually a relatively new agency. I have the honor of being the first general manager of the agency. And very briefly, the agency was built based on the realization by His Highness the Aga Khan that the challenges of climate change, and in many of the countries where we work, Madhukar mentioned them, also man-made risks, essentially create a situation where natural disaster risk was getting worse and worse, and therefore there was a need for more innovative and integrated solutions to help communities keep safe. And therefore, the Aga Khan Agency for Habitat was created by merging the capacities of Focus Humanitarian, which was also active in India, and the Aga Khan Planning and Building Services, again, also active in India. And combined with that, an initiative, a scientific initiative called the DRMI, the Disaster Risk Management Initiative. So it would combine the core skills of community-based disaster resilience, understanding of the physical risks, mapping of the physical risks and predictive capacity, engineers and architects, as well as planners in the Aga Khan Planning and Building Services. And the logic was, A, that we needed to bring these skills together to have more ambitious solutions because the physical risk of natural hazards particularly in mountain and coastal areas, is getting worse and worse because, of course, these communities live on the front lines of where climate change actually happens and need to adapt. And B, to make sure that we don't just help people survive, but that we actually use the same skills to make sure that these communities have a future, can live, cannot just survive, but thrive, so that the next generation of people in these communities have the same opportunities as people who are living in more secure environments. And I want to note that the more secure environments increasingly are getting less secure, sadly, because of the impact of climate change. Now, this is a basic logic, and we've been working on this for 3.5 years. When at the beginning of this year, actually, Tamisa went to India to act as CEO, and like Madhukar said, nobody could have predicted what would happen then. What happened then, of course, in fact, when I went on my end of year break, I already read in the international edition of the New York Times about some quaint virus in Wuhan province in China and how it was difficult there. And I remember distinctly my wife showed me the article and I said, oh, well, you know, this is one of these things. It will just stay in that province and that'll be that. As my wife told me yesterday, famous last words. What happened is we were all swept away by an epidemic that then became a pandemic with consequences that nobody could have predicted. And all of us scrambled to react. Governments, countries, hospitals, health institutions, disaster management institutions, development organizations. Everybody tried to figure out what to do. And the initial reaction in the Aga Khan Development Network, as I think pretty much everywhere else, is this is a health crisis. Let's listen to the health authorities. Let's listen to the WHO. And we should definitely do that, by the way. Let's let the health professionals manage this crisis so that we can make sure that people get tested, that people get treated, and that we come through this the quickest and the best possible. And at that time, neither us nor many other people realized that this wasn't just a health crisis. It was, in fact, an all-encompassing crisis that put many things at risk and make families deeply insecure. The economic impact, the challenges in the distribution chain, the impact of lockdown and what that does to the weaker in society, and the need to interact with people and get them to behave in a certain way to fight the epidemic, behavioral engagement, and essentially disaster preparedness. And as we moved forward, we therefore realized that what we have been doing and what others in the disaster management practice are doing is key to this crisis. Now, before I speak about that a little more, and Tamisa will speak about that in more depth in terms of how this has worked for us in India, I want to acknowledge our partnership with the National Institute of Disaster Management in India and the NDMA because it's extremely important for us. We were created as an agency specifically to create synergies between disaster management work and development work, because often in the international agencies, the response capacity and development capacity is completely separate. And we feel it's very important to realize that anything we do in disaster management and response has to be done in partnership with government. Disaster preparedness and response is a core responsibility of government. The safety of populations is a core responsibility of government. And certainly the government of India takes this responsibility very, very seriously. So for us, it's important that we don't just work on our own, but that we work in partnership, that we learn together, and that where possible, we may add some learning to the government effort, but mostly that we make sure that we work in a coordinated fashion, not go off on a drill on our own, not go off and respond to the floods in Kerala on our own, but do that in coordination and under the leadership of government. And it's therefore a great honor for us to be associated with the NDMA and the NSRMP, the seismic risk program, where we are supporting the assessment of seismic resilient infrastructure in the mountain and hill states of India. We believe this is really, really important and core to our mandate. And I want to acknowledge Major General how that partnership with the government of India is key to us. But back to COVID, back to where we were. Well, when we realized that COVID was more than just some disease for which we needed a vaccine and maybe a treatment and hospital beds and maybe a test, but we needed a far more encompassing response, we actually drew on the broad partnerships that I'm proud to say we have developed as an agency in our now 4 years of existence. We have a partnership with UN Habitat on planning, and we work with UNHCR on shelters. On shelters, we realized, and this was not directly relevant in India because India has a very strong capacity of its own, but in Afghanistan, Tajikistan, Tanzania, and also Pakistan, there was a need for temporary hospital and treatment facilities in far-flung areas, and we realized that our partnerships on modular shelters with UNHCR and the IKEA Foundation allowed us to leverage sheltering capacity for natural disaster to actually build temporary COVID facilities. And those were built, they were built very quickly. And frankly, we were really pleasantly surprised that we were even able to ship these facilities to countries like Afghanistan, because it was certainly not possible for us to travel there. These facilities are up and running. We learned that the network of volunteers we have who in the mountainous areas in Pakistan and Tajikistan, every winter, before winter, go to every community and talk to them of the risk of avalanche and how to manage, could also be sent to those same communities and talk about physical distancing, mask wearing, not gathering, all the other hand washing. Obviously, we actually have a very large water and sanitation program that we manage. We realize that the behavioral work we do to condition and prepare families to be ready for disaster is very apt for this type of situation. We also realize that our excellent relationship with governments, including in India, allowed us to support other agencies in the network, the Aga Khan Development Network, who have less of a direct engagement with government, so that our efforts would be coordinated and support the work of government, not be off on our own. And I could go on and on and on. It's been very interesting for us to work on this basis. I want to mention that as an agency, in our quest for understanding how we not just can help people save, but actually help them do well to thrive, we work with a range of partners. We work with Harvard, we work with MIT, we work with the University of Central Asia in Kyrgyzstan and Tajikistan. We work with many partners in India, Tata Institute for Social Science lately, but many others all the time, because we realize that the challenge of keeping families safe in a changing world that has climate change, and I personally see pandemic risk as related to climate change because of the overall feeling that there is an imbalance between human and nature, that we need to work together to address these issues, and that if we work together, we can do this. What are the strengths of the disaster management community in this regard? I mentioned a few. Most important thing is that the disaster management community understands that you respond to risk by standard operating procedures, by clear protocols, by good organization, by fast communication and decision making, and by strong logistics. All these elements are absolutely key for how you respond to a disaster. And to me, COVID, of course, it's a disease, it's a virus, but in fact, the crisis is nothing different conceptually than a crisis that you would have if there were a major earthquake. It's just that this earthquake is all over the world. And that therefore, as a disaster management community, we have a lot to contribute, how we help families be prepared to be safe, which is the topic of this seminar, but also how we build systems that allow governments and international organizations to help keep their people safe. And we're very excited to think about this. We know we don't have all the answers, but we can field test solutions as we work in our own geographies where we're field present, and therefore can see what happens if you talk to families in a certain way, how you influence behavior, whether the outcomes are better. This is what we aspire to do. frankly, when COVID hit and we were locked in here in Geneva, and by the way, we're about to be locked in again, I feel, because unfortunately we're in a second wave, we all thought work is like ending. And in fact, what we discovered is that work was beginning. We also discovered, by the way, that because as a disaster management agency, we have the habit of working to protocols, we could quickly develop protocols as to how to respond to natural disasters, because floods and avalanches and rock slides and mudslides and God forbid earthquakes are still happening. How we respond to those while keeping our team safe through proper protocols and behavioral guidance. And the agency has extensively responded to disasters this year during COVID in Afghanistan, in Pakistan, and indeed also in India, and managed to do so respecting proper behavioral guidance and frankly with good results in terms of the infection rate of those who were actively involved in that. This is an important thing we need to learn. I think we need to rapidly fast forward to picking these lessons from the COVID pandemic and rolling them into a global plan for pandemic preparedness. We will certainly do so in the AKDN. We've already started talking about it. And that plan needs to integrate disaster management capacity with the medical and healthcare capacity that is there, which of course remains tremendously important. Again, I want to thank you for inviting me to be part of this this event. It is so nice to speak at an event in India. Again, I miss it so much. I just hope that the opportunity to travel back to India and meet some of you alive, and maybe even, who knows, shake hands in a very distant future. It would be such a pleasure, but otherwise we can always do namaste, and that will be just fine. Thank you very much.
Thank you. Thank you so much, sir, for the inaugural session. And it's always an honor and privilege to have conducted the webinar with Aga Khan Agency for Habitat. Unfortunately, for the keynote address, Major General Manoj Kumar Bindal, Executive Director of NIDM, is unable to join with us due to work obligation. Moving forward with the webinar, we have with us Dr. Sushma Guleria. Dr. Sushma Guleria has a PhD in disaster management, post-tsunami integrated coastal zone management planning for Tamil Nadu. She has over 13 years of experiences in disaster management realm. From 2005 to 2006, she is looking after Center of Climate Resilience and Environment and Center for Water and Land DRR, with focus on eco-DRR, climate and environment-related disaster. We welcome you to our webinar, ma'am.
Thank you so much, Aradhana. Once again, I welcome all the dignitaries. Uno sir, thank you so much for that wonderful insight. And, one thing that we've been trying to harp and advocate with respect to the current pandemic has been, it's what, on one side, yes, we are all aware that there is a need for the very basics, the hygiene, the wearing, even the concept of wearing a mask. But on the other side, practicing that, getting it implemented and making it a part of your system is still something that needs that, rightly said by you, sir, the behavioral guidance. And keeping that in mind, NIDM has also ventured into developing modules for social and behavioral change communication and integrating them with all our other sectoral modules as well. So I welcome once again all of you and even the participants. Moving on, I would share a couple of just to set the base for this particular program, for the participants, for the benefit of all the participants, the importance of what multi-hazard preparedness at a community level or at the household level would require, or just an insight into what the importance of the subject is. So we are all aware, so you have a couple of hazards, natural or human induced, and how they're impacting people. And whenever they come into contacts with different vulnerabilities, it could be social vulnerabilities, which will the current pandemic has been a very apt example of how the vulnerable groups were impacted. So be it the pregnant females, the lactating feeding mothers, the young children, the comorbid patients were one category that came out very starkly in the current pandemic situation. How the coronavirus impact on them was very important. So similarly, likewise, other vulnerable groups. So the social vulnerability aspects, the vulnerability aspects of how people living in different zones across the country can have different impacts or different impending hazards. And to cater to that, what kind of capacities they need to build so that the associated risks can be minimized. So these are all directly and inversely proportional ratios, and once when these terms come in contact, or when you have these vulnerabilities in contact with your hazards, there are chances of different intensity disasters to occur, and to which India has also been a witness. So you keep seeing some of these impacts. Keeping these things in mind, in India, one high-powered committee was established in 1999, and in 2001 they come up with a report based on how water and climate-related disasters are an important concern for us, like incessant rainfalls, hailstorms, cloudbursts. So we have examples of cloudbursts. Leh Ladakh had experienced an intense cloudburst event in 2010, and likewise in the Uttarakhand event of 2013 saw an amalgamation of a lot of concerns, right from the lake burst to heavy rainfalls to landslides, and likewise environmental degradation and detrimental impacts. Droughts are a major concern for the country. Thunder and lightning are turning out to be an important concern for us in the recent times. Geological related disasters like landslides, earthquakes, dam failures, etc. Chemical, industrial, nuclear events are also a prominent part, and India has been a witness to something that we all still remember very vividly, is the Bhopal gas event of 1984, and we are still 30 years on, we are still struggling with some of the social and gender-based concerns and environmental concerns related to that event. So that makes it very prominent. Accident-related hazards and likewise disasters of boat capsizing, village fires, festival-related disasters have been something that India has been a witness to, like a lot of stampede events that occur in religious places. There have been incidences in Uttarakhand and Madhya Pradesh and likewise areas. Oil spills have been a concern. Building collapses are some of the concerns. For the benefit of the administrative purposes or managerial aspects, bomb blasts have also been put in this category, although it's something, it's a pure human intent that drives it, and you can even avoid it otherwise. And another concern for us is the biological related disasters. So from the current one, the corona pandemic has made it very evident. People have started understanding what epidemics are all about, what endemics are disasters, and how pandemics are also impacting all of us. Pest attacks. Very recently, some North Indian states experienced the pest attack event. Haryana, even up to Delhi, these pest pest attack event had occurred, and how they impact your livelihood sources. So they impact your crops, and how that is directly related to the human survival. And likewise, it is applicable for the cattle epidemics also. So the spread of diseases from cattle to humans, and also cattle as important livelihood sources. So their preparedness or prevention is also important, and food poisoning incidences. So these are some of the important concerns for the Indian scenario, and a few prominent natural hazards which have been highlighted by in terms of the statistical numbers. This is developed by the Building Material and Technology Promotion Council of India, but nonetheless, from the purpose of management or administrative concerns, from the purpose of planning concerns, it's always nice to use such statistical details for preparedness. So 59% of India is prone to different earthquakes. 66% of your net zone area is prone to droughts of different intensities. 12% of riverine floodings. That's you have other forms of floodings also. which India witnesses, but this is with respect to specifically to river floodings. And 8% of your coastal areas are prone to cyclones of different intensities, wind speeds of different intensities, and 25%, especially the upper Himalayan regions, are prone to landslides. So these are some of the just a few major natural hazard concerns for India. This is how they've been segregated. So as per this chart, you feel that the hydrometeorological disasters, or which are having an origin in water or climate related, are the ones that mostly are huge in numbers. Just for the depiction, for the purpose of understanding, if you look at the country and you divide the different zones for earthquake, flood, cyclone, drought, and landslides, so you can get a multi-hazard map. So which makes it important that each state or districts, or if you go deep down to the block district level, block levels also, you need to have preparations for more than one hazard, and that's why we say multi-hazard. So you need that kind of a preparation. And with the World Health Organization already, informing, or they've already announced that the coronavirus is still around the corner and it is here to stay for a while. So which also means that, just the concept of social distancing or lockdowns is not feasible all throughout. It will not be, because it also has its own side impacts to it. With respect to economies and lives and livelihoods getting impacted. So you need to get back to your routines, and you need to get back to your living styles. So for that purpose, what is desired is that each household, each community is made aware, and also at each household level, you have that adequate preparedness to take care. The pandemic stays as our main concern as of now. And with the backdrop of these other important hazards that can also impact us. With this, that's not all for us. Unfortunately, if you look at the map, you have the temperatures rising. So with this rise in temperature, you'll have more spans of heat waves. So that also indicates that there will be impacts of how the heat waves will, have their impacts on humans, on cattle, on even to an extent the food productions. And you'll have erratic precipitations. Few parts of the country are already witnessing that. There is a rise in sea level or sea surface temperatures. The Arabian Sea, the Bay of Bengal, the west coast actually, was less prone to cyclonic events as compared to the eastern coast of India. And in the eastern coast, generally you see the pre-monsoon and post-monsoon cyclonic events. But Oki of 2017 was one classic example that the western coast is also now getting, more prone to your cyclonic wind speeds and events. So these tendencies are highlighting that the climate is changing. You will have different desired impacts on places, and there are examples where drought-prone areas are now converting into flood season. They're seeing heavy floodings, and places which used to have apt water availabilities are turning drought-prone. So these are some of the additions, and then they will definitely have impact on how the glaciers will be melting, how variability in monsoons would affect your crop productions, and sea level rise would impact your coastal zones. So these are also a part and parcel of how we are going to, now we have to learn to live with such risk management aspects, and you have to work towards the risk reduction aims. So warmer seasons, cyclonic disturbances, changes in your precipitation levels, etc., will have impact, other secondary impacts on your assets and livelihood status also. So these impacts, already we have had some flaws which were identified based on Indian scenarios, that we were heavily dependent on the army, or inadequate relief management techniques were there. We did not have good hazard risk vulnerability mappings available with us. Awareness levels, community awareness levels, and preparedness was only to an extent. It was very, very limited. Environmental degradations were happening. All these things had led to the establishment of what we now have, the Disaster Management Act of 2005, and then subsequent there have been a lot of guidelines which are developed by the National Disaster Management Authority. One of the guidelines are available are on the biological disasters, wherein you have how to deal with the epidemic and pandemic situations also. These guidelines, the biological guidelines were developed way back in 2008, and with the current pandemic situation of the coronavirus and how as countries, there are more than 200 countries that have been impacted by the single pandemic event, and that definitely calls for a revamping of the entire how the outlook towards dealing with such pandemic situation. So you have the disaster management arena. So you have different steps that you need to take care of. And what is important at a household level is the preparedness aspect, which has two important concerns. So you have early warning. So for people to get such warnings, timely warnings, dissemination of these warnings calls for, it constitutes a very important preparedness measure. And also during any eventuality, there are needs that, the population or communities may be required to temporarily shift to safer zones, relief camps. Now, one challenge that we saw very recently in 2020 itself was with the cyclone Amphan that impacted West Bengal, the state of West Bengal. And you were already dealing with the pandemic situation, which required people to maintain social distances, have adequate health hygiene concerns maintained. But the current particular season of cyclone forced people to move, leave their houses and move to safe shelter sites. And then it became a challenge of, the pandemic concern, because it wasn't that easy for people to maintain those distances. And even during the relief times, it was found that, people were clubbing together. So this becomes a challenge when you are talking, or, you're talking in terms of a multi-hazard concern, because these were two extreme desires to manage cyclones separately and to manage the pandemic separately. So this is just one example. And likewise, we've had seasons where states have were impacted by severe floodings. There have been instances of fire incidences happening, and the pandemic parallelly has been going on. Just for the information of the participants, the 15 Finance Commission has renamed the funds that have been allocated for managing disasters into two categories. So at the national level, it is the National Disaster Risk Management Funds, and at the states, it is the State Disaster Risk Management Funds. What is important here for different states and different stakeholders to note is that these funds have been further bifurcated, and for the purpose of capacity building, for the purpose of preparedness, wherein you can take in measures for community level awareness and community level communication measures. There's 10% of such funding allocations being provided. So your management or your plannings can have these such capacity building initiatives and other initiatives also, like mitigation and long-term reconstruction measures. But from the capacity building perspective or preparedness perspective, you can have these funds utilized. So these, based on some of these examples, like, of course, you need a community shelter, a multi-purpose community shelter. But now you have, like I said, quoted the example of Amphan, you now have the challenge of how you're going to maintain that distances for different people. You will have to restrict, or you'll have to increase the number of such shelter sites so that people can be safely kept in smaller isolated zones, protecting your livestock and all. We are also working with different states at the panchayat levels, helping them plan their village level disaster management plans. That includes the concept of how communities in themselves can be made responsible, can develop their own small plans, preparation measures, and have these concepts of making resources and also small family emergency kits in places. So now when you talk about making these kits, you need to keep in mind your multi-hazard concerns. And we have some few key speakers who will be highlighting some of the different aspects at the family levels or at the individual levels, how you can take care of such things. This was one beautiful concept started in Gujarat, for secluded zones, for places which get marooned due to intense flooding seasons. So, you have vulnerable people. So now think of it from the perspective of even the pandemic. So you might have you as patients, or you might have small children and comorbid people around you within that community, and you now also have to deal with the flood situation. So what these communities do is they have their own preparedness as a measure. They store their grains from their houses, so that until the external help reaches them, there is relief that reaches them. After a while, it takes time for that help to reach them. The children, the vulnerable sections of that particular community, they can still sustain themselves. So that was a good concept, and we try and advocate this concept in some of our village level plannings also. And of course, I'm sure you'll have more details of how to prepare these family emergency kits and have survival kits ready from a multi-purpose preparedness perspective. So with these few words, this is just to set the base for this session. And thank you so much. We'll take up questions later. Thank you. Over to you, Aradhana.
Thank you. Thank you so much, ma'am. Thank you for speaking on the session of new normal and multi-hazard preparedness at household level. Now, session we have Ms. Tamiza Alibai, Chief Executive Officer, Aga Khan Agency for Habitat. Ms. Tamiza is currently Chief Executive Officer for Aga Khan Agency for Habitat India since last 1 year. She is associated with Aga Khan Development Network for over 10 years and has worked in Afghanistan and other countries in region. Since 2016, she was based in Aga Khan head office in Geneva for 4 years. Prior to it, she was in business consulting world in Europe and US for 14 years. We welcome you to our webinar, ma'am. I will be sharing the presentation.
Thank you so much. I want to, first of all, please pass on my best regards and my gratitude to Major General Bindal and, of course, to the NIDM team for this opportunity to partner with you all and to talk about this very important subject. Thank you, Anu, for joining us from Switzerland and always helping us to stay centered in our strategies of how to continue to save lives. I want to thank Sushma for a really very interesting set of points that you brought forward. And it's also encouraging to me to hear what you've said, because it's very much aligned, obviously, with the kinds of approaches that we have been taking at ACA. Please, if you will, advance the slides. I'm not sure if it's moving, but on my screen, it's not. So if we can go to slide 3, that would be great.
Yes, ma'am. I'm on slide 3.
Okay.
So
it's not visible, Aradhana.
Oh, okay.
Aradhana, you can reshare it. It will work.
Is it visible now?
No, we only see the logo. Yeah, you can move the slide now.
Okay, so I will share my screen.
Yes, actually, it's ma'am Tamiza who's sharing the desktop.
Okay.
I'm not sure if okay. So what I'd like to start with is just give you an overview first of the emergency management framework that we've developed at ACA. As Ono has mentioned, that ACA in its current form is about 4 or 5 years old. But we're based on a legacy of work that stretches back several decades. And through this legacy agency's work and our experience in responding to and preparing communities and responding to disasters, we've had the opportunity to develop methods and tools for continuous improvement. And this framework here represents at the moment where we are with our thinking. We, of course, as Ono had mentioned, first recognize that the government mechanisms are the first important layer in ensuring effective emergency preparedness and response in a community. However, within the framework of the government, ACA aims to build community resilience and preparedness, but also to equip communities to ensure both community level and institutional level readiness is in position for rapid and competent response. To do this, we followed this emergency management framework that looks at all levels of the cycle. And first, we begin with preparedness. So as you can see, through preparedness, we are able to then respond and then recover and rebuild or help to rebuild communities from the ground up. But in order to do that, we must be in sync with the government and the other civil society agencies that work in the disaster management community. For us, a lot of the preparedness work is around risk anticipation, looking at hazard vulnerability risk maps, where communities are situated within those risks and what behavioral changes we need to encourage them to engage in. For example, for many years, we would see that communities would build homes and institutional buildings right in the pathway of mudslides or right in the pathway of rising river levels or in coastal areas. And some of the work that we've done with communities is to have them understand that the reasons for not doing so, and in order for them to continue to build for the future and not continuously every season be washed away, literally. So as part of that community preparedness, we put in place first responder capacities in the form of emergency response teams that are made up of volunteers from the community. And we augment that with specialized teams such as search and rescue teams to help them to shore up their support when it's needed. In addition to those aspects, we put in place early warning systems and stockpiles, communication networks, in order to make sure that when an incident happens, that all the various gaps in that can exist in making sure that rapid response is provided to the affected, we make sure we take care of that ahead of time. That includes, very importantly, engaging and developing partnerships well ahead of time with the other civil society organizations that work with us, other NGOs, and most definitely with the government bodies at the district and block levels. So our work with the NDMA, with our relationships with the state disaster management authorities, our relationships with the district levels and taluka levels are ones that we really find very important in making sure that there's interoperability during the time of an event. Beyond that, we have many other aspects within response, recovery and rebuilding of the phase of the emergency management framework. But what I want to highlight as we move to the next slide is that the key at the center of the entire process is the communities and is the families. So at the center of our framework is the family. The family emergency preparedness plan, preparedness and response plan that we have envisioned is really our method by which we bring the culture of awareness and preparedness to the household table. And we have spent many years developing different ways to build that awareness with communities. In this case, for COVID, we've developed a simple process which we encourage families to sit with their loved ones and consider their risks through answering a series of questions that allow them to actually be proactive and engage in their own safeguarding. What we find, whether it's an avalanche or a flood or in this case the pandemic, that there is a paralysis that sets into individuals, and their ability to have confidence in their own care is obliterated. Many for a long time would tell us that, well, these are acts of God and there's not much that we can do about it except to endure. And over many years of working with communities, we've actually found that as you develop their awareness, build skills in their families, work not just with the men in the family, the females in the family, and the children in the families through engaging with them in their school environments, but also in their home environments, there is a confidence that starts to build across the entire family, and a way for them to understand actually how they are going to work together in order to safeguard themselves in the event of a response. Some of the risks that we ask these families to think about is in the multi-hazard preparedness perspective. Sushma, you very well described through the example in the cyclone in the west during the pandemic, and the kinds of things that were happening with houses being destroyed, other diseases becoming a vulnerability, and at that point in the process, it's very difficult for people to understand what they should do first or second. And so when we approach and work with families, we look at it as a multi-hazard situation. And we encourage them to look at the things that would all occur together. We do, however, find, as you have mentioned, that many of the responses that the family has to engage in are the same regardless of the cause. So the kinds of things that we have developed, at least for the pandemic, especially right now, is we have the families go through a questionnaire and help them to, in a safe environment, envision, or not envision, but perhaps to think about what would happen if one of their family members or loved ones does contract the virus. And just engaging them in that conversation takes some time because it is a frightening prospect for them. Once we have been able to get them over that initial scare, you find that they have very interesting and practical ways in which that they will respond. But it does take them some time to understand that the connections between all the hazards really do affect them, and the way in which they actually have to sit down and look at the risks in their families. For example, what family members are in more vulnerable situation because of other diseases that they may be dealing with. Perhaps they're living in an environment where that they are responsible for several households in a nearby area and not just theirs. What is the blood group of many of these people? Where are the insurance cards? How do you access the various family resources that you might need? What are the phone numbers that you should have handy? What should be in your preparedness kit, not just for a pandemic, but for other multi-hazard situations? And making sure that you actually go through drills of this in your own family. So we find that just sitting together at the table and having these discussions are something that families are not used to, or they look at it as something that they will do in the future. One key gap that we have obviously found is that oftentimes the key earning member of the household is the one affected first. And unfortunately, because of various cultural and other constraints, the female members of households aren't aware of all the family resources and how to access them. They may not even have access to the right communication devices to be able to engage in the response. In the planning of and preparedness of plans for a family, we include initially from the very beginning the female members of the family as well as the children. And this is what brings me now to the gender mainstreaming aspects that we find very important. It is fair to say that we know disasters affect the entire community. However, persons who are marginalized, women, children, other underprivileged, people who are challenged in different ways, are affected much more. And primarily because they are not part of the process of planning, or that their knowledge and understanding and their concerns are not taken into consideration from the very beginning. I think it's also fair to say that integrating women in the preparedness and response planning actually saves lives, because they have a broader perspective of all the needs of the various members of the family that may not be so aware in the awareness of the primary decision maker. We know the constraints as we've listed here on the slides. We've known them in this community with these people that we are here with today, so I don't need to go through them. But I want to tell you some of the things that we do at a high level with the amount of time that I have today. And eventually, when we have the opportunity, we would invite all of you to come and see some of our work. But one of the first things that we do is we integrate female members of the family in the decision-making process and the risk identification of a process. So the idea is we want to involve them both in the planning and preparedness and all the way through response, because we know that a plan ultimately is a plan. In the event of a response, the plan becomes an active thing, but requires on-the-spot decision making. And in that process, it is important to have women as part of all of the various teams, because in that moment they are able to help make decisions that others to see in terms of seeing things that are happening that perhaps the male members of the teams don't see. So what we do is we actually incorporate them into our what we call the community emergency response teams, where we give both sides equal training in terms of first aid skills, in terms of light search and rescue, in terms of being able to address in the moment particular situations that are arising. Because we know that the importance of first responder capacity in a response is actually the first thing that we find that saves lives. The other things we also do is include them in the more specialized, more intense training and specialized response teams, such as our search and rescue teams. We do specialized training for women in order for them to then take back that learning to their communities and ultimately into their households. So with this, I'll stop here and I'll turn it back to you. I want to thank you again for the opportunity, and I look forward very much to this continued relationship that we have, and to share our learnings and incorporate our knowledge so that we can take it back to all the communities that we all work with. Thank you very much.
Thank you. Thank you. Thank you for speaking on building the resilience of communities for multi-hazard during COVID pandemic, with special emphasis on family emergency management, focusing on gender mainstreaming. Moving ahead with the session, we have Dr. Zara Ladakh Merchant, Chairperson Aga Khan Health Board for India. Currently, Dr. Zara Merchant is Chairperson of Aga Khan Health Board for India and has been working closely with Aga Khan Agency for Habitat on Community Preparedness and Response Fund. She has over 15 years of experience in the space of public health care service and youth development. Dr. Zara's experience ranges from quality of healthcare to patient safety and cancer prevention, and also to adolescent and adult health through lifestyle diseases. We welcome you to our webinar, ma'am. Hopefully, I'll be able to share the presentation. Just 1 second.
Or if I could share my screen, Aradhana.
Ma'am, will you be able to share your screen?
It doesn't give me the permission, Aradhana. Is there?
And now I've made you the presenter.
Yeah.
Okay. Yes, ma'am.
Does that help? Yeah. So you can see my screen now?
Yes, ma'am.
Okay. Thank you, Aradhana, for the introductions. And thank you to NIDM as well as to ARCA for this opportunity. This opportunity and the opportunity to partner and learn and serve over the last many months. Good afternoon to everyone here. So while I would be speaking about my experiences with COVID as the board, as a health board, I'm sure each of us in this room has experienced COVID up close and personal in different perspectives from different quarters. We have government organizations, we have civil organizations, and we have also individuals here who are joining in. So one thing is a given that a pandemic today, other emergencies tomorrow, these are cyclical. We've heard over the last 1 hour and over the last 6 months what we've experienced. The one thing which is clear is that emergencies should not surprise us anymore. I think we need to be better prepared and braced, and there are no two ways about it. And in that endeavor, the engagement of the community and community preparedness is absolutely integral. So as a doctor, I still words saying that listen to the patient. He's giving you the diagnosis. So it's a patient who's telling us what the diagnosis is, and it's a community who will tell us where the work needs to be done, where the gaps are, and where preparedness needs to be ramped up. So engagement with the community, listening to the community is a no-brainer. How do I change screen? Some of these will look familiar to us. Images will look familiar to us. These are images of the pandemic that we are still living. We are not out of it yet, but and we are still here. Give me just a moment. Yeah. What I want to share with the team here is panic, anxiety, uncertainty has really defined the last 6 months for us. And while our work in development continues, that's routine work, quickly moving into disaster pandemic mode has taught us a few lessons, and are lessons that we should build on in the coming months and years. And I'm going to discuss it over these few headings. Communication. In good humor, we call it infodemic. The pandemic is on. We've all been witness, we've all experienced misinformation, and there has been an information overload, which leads to an analysis paralysis mode and some sort of inertia where one doesn't know what's right and what's not because of the sheer nature of something that hits you immediately and hits you so hard. To add to that, there have been contradictory advisories because there has been ambiguity on this topic, especially when it comes to COVID. Some of the others are more clearly understood, but COVID clearly took us by storm. So first, there were speculations, there were questions and speculations, which then became theories with bit of understanding coming up. And eventually there was evidence-based came, which often overrode the guidelines of the past. And many of us would have gone through the process of where sort of your ministries and WHO are actually doling out advisories on a daily or weekly basis, which is all in good intent and all with good evidence. But this also questions the trust that the public has in the public health system. What do we do? So what we realize, and some of this might be repetitive, so I'll go over it quickly. If you see the box in the middle, there is awareness, which is information that we are sharing. But with the information, we also want to bring about a change in the attitude. Wear a mask because da-da-da-da is awareness. But actually a change in attitude will figure out where you wear a mask. And we've seen enough of those graphics, which will actually impact behavior change. When it comes to material, they got to be, I mean, while it's important as an organization to create your own material and have your own voice and have that visibility and branding in the community, there is enough material out there, well-researched, credible sources. So a combination of creating material and curating material from the outside world has worked well for us in the situation and quickly make our communications available. If you look at the triangle to the left of the screen, when we talk about engagement and communication, we largely look at community. We look at the beneficiaries, the public. But what we do know is that before we go out there, having our base strong and solid with our partners, which are the clinics and the hospitals and outreach workers, as well as the internal teams and volunteers, is probably more important. And in view of that, we actually started training our volunteers and hospital doctors mid-March, third week of March, when we just about started the lockdown, with basic infection control modalities, mechanisms, understanding the principles of infection control, while we were still also understanding the virus. Is also the advisory on masks and how it changed over the many months. So at first it was a particular kind of, so first there was, oh, why do you want to even store masks? Because the healthcare providers do not have enough. Then we were advised, oh, you need a mask of this particular specification. And we realized that a huge socioeconomic divide that was being created. And then there were advices that a regular mask would do. But how you wear a mask is probably more important. So it's important. So I think the nuances of communication are essential. In all our good intent, we often want to perhaps tone down the risks that are out there. But research has shown that putting the risks out there and making the communication clear will equip our communities and our providers to be able to deal with it better than what one's mind and imagination conjures up. So the paralysis analysis that we get stuck in can probably be addressed by clear communication. Which moves on to embracing new knowledge. So the understanding of masks, the understanding of how the disease is transmitted is new knowledge that keeps coming up, which is why technical training and having set protocols for response are so essential. And this is something that we've heard about in the last few minutes as well. It is the protocol which will really define our quality of response at scale, at a mass level. So once the communication is going out, surveillance, which means tracking and data monitoring and being able to sort of make sense of the data. And we talk about a PDSA cycle, which is also what the MISA shared in a similar cyclical manner. We plan, we do, we study what we are doing and act immediately on it, because this is an iterative process. There are no answers. It's gray area at the moment. So a quick iterative cycle, protecting our providers, not just with PPE, but also equipping them. So a clinician can only work if they have a ventilator working, if they have X number of beds, if they have a certain bed to patient ratio and a certain bed to doctor ratio, and the knowledge to be able to use it. And this is perhaps where long-term planning, when we talk about preparedness beyond the pandemic and learning from the fact, which not that we didn't know that before, but the fact that our healthcare resources are not adequate to respond to the populace comes in. So PPE, physical protection as well as emotional protection. These frontline workers that we often, which have rightly been called the yodhas, the warriors on the front. It's a stressful job. So having them able to offload their stress with peer review, peer scheduling their work hours and days is not something that we can lose sight of. So we spoke about moving quickly from routine into pandemic mode or any other disaster mode, which will need more than what we have today, which will need quick assimilation and quick ramp up of our resources. So the you see on the right, help, there is only so much that one can do, but we need to, and this is what we did, sort of partner with the safety and security teams or social welfare teams to be able to address not just the health piece of the emergency of the pandemic, but also the social and security and emotional needs of the community. Quickly repurposing our roles within and therefore with others. Extremely high IQ is what one needs. There is no guarantee for this, but again, sort of peer support. And I want to say being connected, not distant, but connected is what can help. Creativity is a no-brainer in this case. Scenario planning, and this is something that ACA was instrumental in having us think through different scenes, that if there is a patient who develops symptoms and is staying alone, how do we act? There are people who are staying in the remote areas, rural or even urban remote areas. What do we do? So if there's a bed available, what are the stopgap mechanisms that one can put in? These are the scenario plannings that will help us anticipate what's coming. And when we talk about anticipating, we need strategic thinkers to be able to look at the long haul. At first, we thought the pandemic it's a 3-month issue, and we'll be done. We'll be back to routine in June, maybe by September. And now we know it's probably going to be another 12 months, if not more. So while we do need doers and implementers who will work today and who will work on the field, the team also needs a good mix of thinkers who will be able to strategize in the long term. And of course, engaging local leadership and influencers. Dharavi, the Indian slums Dharavi is a clear example of successes where local leadership took up the responsibility of communication, of risk reduction, of ensuring behavior change, and made success happen. So it wasn't fluke. It probably isn't herd immunity yet, but it is really local efforts that have saved the day. Which takes us to, we may save the day, we may do the awareness, but who's really offering the care and services? So we have 3 buckets in which work has happened. Managing health situations, it could be COVID, it could be other morbidities or other health situations that might arise. It's managing the lockdown, which is inextricably woven with financial, social, and interpersonal aspects. I mean, we've all been locked up in our homes with people we love the most, and it's still driven us up the wall. So it's more than just a health crisis, as Ono said, which brings us to the third box, the mental health implications. And mental health epidemic has been a pandemic, is a pandemic in a pandemic. While we are all grappling with COVID, the mental health cases or severity is rising. I want to take a moment to request all of you here to, and over the last 6 months, I won't be able to see a show of hands, but maybe you can go through an internal journey. How many of us have experienced anxiety, sadness to the point of depression, confusion, mental fog, as we say, which are all sort of different severities of emotional distress, mental wellness. Each of us has experienced this, and this is likely to rise. So my request here is that whether we are providers, whether we are consumers of care, this is an area that will need all of us to sort of really come together and give it all we have. This is my favorite. So this is a public health model, risk reduction. So if you look at the Swiss cheese, none of the layers are foolproof. None of the layers are 100% perfect, but put together will bring us protection, will reduce the risk, will reduce the error. So the risk reduction model in public health talks about zero damage is desirable, but may not be realistic, and therefore we aim for risk reduction to all of these different steps. It's not an either or, it's all of them put together. And well, I can't say research evidence, but theories that have come and initial data that is coming in does show that these base 4 steps of distancing, wearing the mask, hand hygiene, and early testing does reduce 80% of the caseload. So us as public health workers would be able to find the gaps in the Swiss cheese model and perhaps adjust the layers to be able to protect our community better. Every storm has a silver lining, and while we are still in this storm, some silver linings which have appeared is the uptake of technology and telemedicine. We've moved from room to Zoom. Zoom has really become a household word now, whether it's talk about e-schooling or training or catching up with family and friends. This was unthinkable about 6 months back, but here we are. And with telemedicine, there has been an opportunity to overcome the barriers, the physical, geographical barriers, social barriers to care. And therefore, there is an opportunity to increase access to care. Clearly, we know that a year later, give or take a few months, when we are sort of back to the new normal, a lot of our practices which we are doing today, be it virtual, be it WebEx, will continue. And hopefully telemedicine will also continue to help us access those geographies and areas which were not otherwise available to us before. We've spoken about mental wellness, and I want to talk about lifestyle diseases. These are sort of the two big burdens that public health is struggling with. And, this has given us an opportunity to reinforce the importance of lifestyle diseases, which increases the risk as well as the severity of COVID and mental illness. What COVID has also done is put a spotlight on all the things in our society. So disparities due to health status, due to socio-economic status, geographic, be it rural to urban divide, all of this has sort of really come under the spotlight. And there's been an awareness, there's been a recognition of these disparities, and therefore an opportunity to address them. While the government remains the largest provider and therefore responder to health crisis, I think there is enough opportunity and responsibility in the civil organizations to be able to support and maybe even show successes that can be scaled up. And that's our way. Why storm? There will be moments of calm. Storm will rise again, like on a side. It's probably when you thought you've overcome the battle, but we are in for part 2. But I do hope and pray that we are able to quickly trap the virus, to grow stronger and more connected. Thank you.
Thank you so much, ma'am. Thank you for the very insightful presentation on public health emergencies and community preparedness during COVID-19 pandemic. Moving forward with the section, we have Mr. Dioraj, Program Coordinator, Preparedness and Safety, Aga Khan Agency for Habitat. Mr. Dioraj Gurung is currently Program Coordinator for Preparedness and Safety at Aga Khan Agency for Habitat, Tajikistan. He has over 20 years of professional experience in the field of DRR, and all through his career, he has strong advocate of scientific research and technological innovation. Prior to his current position, While at International Center for Integrated Mountain Development, he has led efforts to promote satellite technology and low-cost solutions to improve the situational awareness and decision-making in DRR arena. We welcome you to a webinar, sir. I hope you're able to share the screen.
Am I audible?
Yes, sir.
Okay, thank you so much. Give me a minute. Is it visible, my screen?
So it's loading. Yes, sir. So humble request if you could make it full screen. Yes, sir. Thank you, sir.
Okay, thank you, Aradhana, and thank you, NIDM and ACA. Good morning, good afternoon, good evening, wherever you are logging in from. I am Dev Guru, working out of Dushanbe, Tajikistan as a program coordinator, and I have been given a very easy task: talk about science and technology, or how science and technology can help disaster resilience of the communities. To me, I think the term help is a gross understatement, because science and technology has really been a game changer in our field. Okay. Even globally, there is a growing emphasis on science and technology in the discourse on discourse on DRR at the global level. If you look at this chart, comparing Hyogo framework and the Sendai framework, two very important global framework for DRR, the number of times the science and technology has been referred, has doubled or tripled from Sendai framework compared to the Hyogo framework. This indicates there is a growing emphasis on investment on science and technology in the field of DRR. What I'll do in 15 minutes of my talk time is I'll try to walk you through some of the examples that ACA has been very proactive in trying to promote science and technology in addressing disaster resilience of the communities in the areas that we are working, as well as I will bring some examples not only from India but also from other ACA countries, just to highlight how important is science and technology in the field of DRR. I think understanding risk and identifying underlying vulnerabilities, it holds key to the resilience building. At ACA, we have internalized a risk screening process, very scientifically based and also very robust. Across the agencies, it's known as HBRA, and it is foundational to our ACA's work. Nothing moves without HBRA surveys. Take my word, nothing moves without the HBRA surveys in ACA and also across AKDN agencies. It entails generating lots of field data, analyzing lots of field data, both hazard as well as vulnerability data, and also managing the data at the back end. The map that you are seeing here is the risk map of one of the town here in Tajikistan. And this sort of maps are generated for all the settlements that we have so far covered across 5 countries. And this maps helps us for very risk-sensitive planning, priority risk management, and also developing hazard-specific programs across all these countries. So far, across 5 countries, we have completed SBRA for 2,462 settlements, villages. These are very community level exercise and also multi-hazard focused. We often get drawn to the front end systems, but often do not give much importance to the database that sits on the background of what we see in the front, the flashy maps and applications. But at ACA, each and every country, we maintain a very comprehensive and centralized HBRA database containing multifaceted data from socioeconomic to demographic to hazards to services to access, whatever is relevant to DRR. And having this assets within our reach it was very timely towards the beginning of the COVID that we had a look into the data sets and help us at least make an initial plan and prioritize settlements for emergency services in terms of responding to the oftentimes when we are faced with this level of crisis, the need for data and also the data being generated spikes up. And at times when we have data coming in from different sources, we arrive in a situation where we do not exactly know what to do with this kind of data. And in the discussions that I have with my colleagues, they refer that as something of a sort of a data debris. We have a debris of data, but we don't know really how to make use of it. Now, big data and analytics has really revolutionized the way that we bring all the different data from the different sources and help us provide an insight into key elements where we will be able to be guided by this kind of analysis in terms of planning our response, planning our future preparedness. For in case of COVID-19, the data that came in from different sources has really helped us track cases, do a hotspot mapping, implement zonings, and also in most of the cases where we have access to high modeling computation facilities, they have been able to use also for the prediction. And at every ACA countries, we had our own dashboard to cover the area that we have been working and drawing data and informations from the national databases. We very well know that the technology, science and technology, is in the middle and the front and the middle, or in case of fighting against the COVID-19, particularly related to testing and the treatment. But we also have seen over the months that a lot of applications, scientific tools developed to help us with the tracing. On the right top, that is our own application developed by our in India. The below on the right is an application that was developed in Singapore, which uses digital IDs and digital footprints to track the individuals with using their mobile connectivity and mobile networks. On the left below, that is an application based on the cell phone locations in reference to the towers, which was used in China to monitor the movement of the huge masses during their vacations. So this technology not only has been very helpful in testing and treatment protocols, but has also been very helpful in tracing and tracking of the cases. Social media really has revolutionized the way that we communicate to each other. Although this is something that mostly been used during the normal times, but during the disaster, people turn to social media to seek as well as serve information. This has really been seen as a way that we can collect information from the ground, and there is a growing use of the term citizen science, where we are trying to use citizens and normal people on the ground to provide us the information that we need and use them as a sensor. This informal sort of communications has been very helpful. You see in case in Bhutan and Assam, where messages that were sent from Bhutan through informal communication like WhatsApp has been able to save some lives in Assam. And there are similar stories that runs through a case in between Nepal and India. The advantage of the informal communication is that it doesn't depend, or it doesn't need to route through those formal channels sometimes, which takes time to get through your message from one end to the other. We as urban dwellers sometimes take for ability to communicate using our mobile phones or anything to a person in any part of the world. But if you consider those remote villages where they remain closed because of the snowfall for a couple of months, or because of a disaster like flood and landslide for a couple of months, completely cut off from the urban centers, the outside world, the very possibility of communicating during the emergency it makes a difference between their lives and death. So ACA, all throughout the countries that we are operating, we have been trying to use and promote the use of science and technological innovations to institute emergency communication systems so that the vulnerable communities at least can make a connection during their difficult times. What you see on the left is a VCN, is a village communication network in Bambian province in Afghanistan. What you're seeing on the right is, again, a Kodan-based communication system in Far Murghab district or Murghab village in Tajikistan. All over the ACA operating countries, we have been able to install over 2,000 systems to give access during the communication to remote villages. Something that has been in talk for last decade or so is something called IoT, Internet of Things. It basically refers to a collection of gadgets connected through softwares and through talking to each, connected through remote servers through internet. This has really helped us monitor as well as set up an early warning system to inform the vulnerable communities. What you are seeing on the left is a photograph of a similar system where we have, I think, in partnership with ECMOD, able to establish several warning system both in India, Afghanistan, and Pakistan, where the communities in the low-lying floodlands are alerted when there is any increase in the flood level. On the right is, again, a very unique case that you see in the Western Himalaya and also in Karakoram ranges, where we have noticed glaciers surging very fast. This particular glacier called Sesper Glacier, had been noticed to be surging from 2018, and it has surged about 4 to 5 kilometers downstream from its original position. At some days, surging about 4 meters in a day, and this has threatened the downstream communities. Not only threatened, but also damaged a lot of community infrastructures. So there was a need for us to keep track of how things are evolving in the upstream to safeguard the communities in the downstream. So here, ACA, along with the National Disaster Management Authority in Pakistan, has put in a monitoring system using a CCTV camera to keep track of the advancing glacier. This is something that is very close to my heart. I had to work in promoting satellite technology for over a decade while in ECMOD. When you talk about the life-saving capacities of science and technology, this is one very prominent case where under the watchful eyes of satellite systems that flies very high, we can able to gather and analyze this information to provide us actionable and timely information so that we can mobilize people on the ground like volunteers. This is a case in 2013 when ACA India, using the information and data that the IMD had issued, able to map the track trajectory of the cyclone and able to mobilize the communities in the ground in time to save many, many lives. ACA also works, as I said, in most of the mountainous country in a couple of countries. These places are very prone to avalanches. We have established a very, say, modest kind of a weather monitoring post, which is manually operated. There are total about 80 AWMPs all across this mountainous country. It collects daily weather parameters, which gets looked by and ingested into avalanche modeling by our avalanche expert. And then he issues a weekly bulletin using which we are able to mobilize our team if necessary in the ground and alert our communities. This is something that is developing as a new frontiers, autonomous aerial vehicle. It's a new thing that's being tried and tested in our field. This provides us an opportunity to fill the gap if there is a need for high resolution images or DEM. This has also been used in different continents and countries for delivery of emergency services, along with artificial intelligence. Autonomous aerial vehicle is further going to change the way that we operate. So I just wanted to leave this with this comment, a conclusion, and thank you for the opportunity given for us to present some of the work that ACA is doing across the country. Thank you so much, Aradhana.
Thank you. Thank you, sir, for the presentation on applying technology and scientific approach for building risk resilience of communities. Now, moving ahead with the session, we have reached to the question answer round where the participants can ask the questions, queries to the panelists, and we can have, hopefully, we can have a very interactive session. Dr. Sushma, shall we take the questions from the chat box?
Yes, Aradhana, I've mentioned it also in the chat box. So I think they can either raise their hands, unmute themselves and ask questions, or they can post the questions also. We'll read it out.
Yeah, there is an option to raise the hand. If the participants have any question or queries, they can click in the button and hence unmute their mic. We have with us Reshma Bilasna. Ma'am, am I clear? Hello?
Yes, Aradhana, continue.
Yeah, hello.
Yes, sir.
Good afternoon. This is Ramesh Sudhan from border town of Uri, Kashmir, UT of Jammu and Kashmir. I have a question to both the panelists from Aga Khan Development Foundation. First of all, let me congratulate them for the work they have done post reconstruction of Uri earthquake 2005. So I would like to ask that do you still have do you with the people with for administration, and what kind of follow-up you are doing for the earthquake of 2005, and also what are the resources, and if any resources available to us for consultation or for our guidance, as I'm a disaster management professional here, so I would like to consult that. And two questions that if you are still in contact with the people there, and of any follow-up after the 2005 earthquake, and also about the resources, if any, which you have done during the 2005 post-reconstruction earthquake. Thank you so much.
Dhukar, do you want to go ahead and take that question? Hi, Madhukar, I think you might be on mute.
Hello?
Okay, well, shall I go ahead? Ramesh, thank you so much for your kind words and for your question. It's since the time of the recovery work that was done in the 2005. We have used a lot of the learnings that we had there to to inform a lot of our recovery work that we've done past that point. At the moment, I myself am not in contact with anyone in particular, but we do have relationships that continue and within various team members that were part of the process at the time. As far as resources, we are certainly have the ability to share all of our learnings that we're continuously having in the field of disaster management, in the field of preparedness and response, and would be happy to share with you and other disaster management people in the community. So perhaps we can take that offline, and when you have more questions, if you have more questions, we can try to answer those more specifically.
Dr. Sushma, shall we continue with the question answer or?
Yeah, sure. To our panelists, to them, to Ramesh. Okay, if I may just add to what ma'am has just said, from the from the learnings even to others, just 1 year before the Kashmir earthquake of 2005, India experienced, many states in India experienced tsunami, which was fairly something very new, and it shook the nation and even lot of other countries. And in terms of how the ex gratia was, disbursed, it was, very overwhelming during the tsunami time. And after a while, that reconstruction process, it's a long-term planning. It involves a lot of planning, and then, you move ahead into the whole reconstruction part. And once when the government of Tamil Nadu, especially the government of Tamil Nadu, when they started working on the reconstruction aspects, a lot of old women, a lot of female-headed households, they all turned up to the government officials, and they started complaining that there's no funding which was available to them. And it was a surprise, because there was a lot of money that had flown in from all humanitarian agencies and also the governments. And where did all that money disappear? So the learning came out that, providing a lot of money straight away into one's hand, maybe into one member of the household, did not end up in constructive utilization of that payments. So 1 year after that, when Kashmir earthquake happened, this is something that I had learned when we were, just covering that particular event, that the government decided that rather than disbursing the money directly into the hands of one person, they would either ensure that bank accounts are opened, and as a joint accounts, these installments were paid to them. So this is one very good learning that was implemented from one disaster that was implemented in the other case, in the Kashmir earthquake of 2005, that we had come across, learned. Thank you. Any other questions? Anyone else? Then maybe should we wind it up?
Yes, ma'am.
Aradhana?
So we have come to the end of the webinar session, and now I'll be giving a vote of thanks. Firstly, I would like to thank our Executive Director of NIDM, Major General Manoj Kumar Bindal, as well as Mr. Honorul, General Manager, Aga Khan Agency.
Yes, Aradhana, I'm sorry to interrupt. Since
Yes,
we still have Ono sir around, maybe we can request him for just a few closing remarks, and maybe a road ahead, for all of us to have some, we can take up some future collaborations together. Ono sir?
Oh, you're giving me more work to do. No, I've been listening all the time, because I believe the discussion is really important. So first of all, I want to thank NIDM and the team for organizing the webinar, and everybody who spoke. And what I learned is that in the disaster management community, we're thinking about along the same lines. We understand the issues in a comprehensive way. I was, by the way, also very grateful for for the comments of Ms. Merchant on behalf of the Aga Khan Health Board. We understand the issues in a holistic way. We understand how, no matter what the cause of the disaster, we need to prepare families in the same way. We understand the value of science and behaviors to get people better prepared and in a better situation. So what I would like us to do is quite simply keep exchanging our learning, keep reaching out, keep talking, and keep making sure that we all build on each other's learning. Because unfortunately, as many have said, COVID is with us. COVID will be with us for some time. And even if it's no longer with us in a threatening way, the notion of pandemic preparedness is now really, really relevant for all of us. So I would hope that we could work on this together, bit by bit, building and also strengthening the relationship with the disaster relief community and the healthcare and public health community, so that we can together achieve better results. We are committed to that as the Aga Khan Development Network, and we're committed to working with all partners, but in particular with the governments of the countries where we work. I want to thank you very much for taking the time today.
Thank you, sir. I would also like to thank Mr. Madhurkar Sanap, Head of Emergency Management, Aga Khan Agency, Habitat of India. I would like to thank Executive Director, Mr. Onurul and Mr. Madhurkar for their support, guidance, and motivation. We appreciate our esteemed speakers for the session. We had with us Dr. Sushma Guleria, Ms. Tamiza Alibai, Dr. Zara Ladakh Merchant, and Mr. Dio Raj for the very insightful and informative presentation. And I would also like to thank Mr. Santosh Kumar for coordinating and managing the webinar, and especially helping me with all the phone calls and all the mails. And lastly, I would like to thank our participants who are our major focus participants. So I'm very glad and thankful for all the participants for the patience as well as for their time. It is highly appreciated. Hoping for the same response in near future. I just have two announcements for the participants. Sorry, this is for the certificate. Usually, feedback link is sent to all the participants in their email address. And after the completion of the feedback form, the e-certificate will be generated. And the presentation will be shared to all the participants in their respective email ID. With this note, I would like to end the webinar. If the panelist has to say anything, then they can go forward. Or shall I end the webinar? Okay. On this note, I would like to end the webinar. Thank you all for your time and patience. Thank you.
Thank you all, and be safe. Have a good evening. Bye-bye.
Thank you.
Thank you so much. Take care.